Whenever you are ready.
All right, so what are we talking about today? Off-season injury concerns.
Eric Fisher.
Eric Fisher of the Achilles tendon rupture.
Yeah, but he doesn't have a team. But you got Cam Newton, who just signed a one-year contract.
Okay. Who do you want to talk about first?
Let's do Cam. He's more famous.
All right. So, Cam Newton, rotator cuff tear in 2017, came back, had a repeat surgery in 2019 to get rid of some of the scar tissue that forms after these surgeries. Apparently, that wasn't a big deal. But the question is, what happens to NFL quarterbacks with rotator cuff repairs? He just signed a new contract, right? 1 year?
Yeah.
Yeah. So, rotator cuff tears in NFL quarterbacks are not that common, right? You see them a lot in baseball players because most of the time in baseball, and in pitchers in particular, because they're overuse injuries. You know, they have overhead throwing. Well, that's the only way they throw. Overhead, they throw an awful lot, and the forces that are generated from a pitch are much more than from a quarterback, launching the football. So you don't see the same types of rotator cuff tears in quarterbacks as you do in baseball players, and you don't see them in the same frequency. Now, that being said, rotator cuff tear is going to affect an individual, but how much it's going to affect these elite players, I don't know. It's hard to tell. If I tore my rotator cuff, I don't think I'd get back to the same level I was prior to the injury. That's because I'm not an elite super athlete. These individuals are just different. There's something different about their bodies. They still have to heal, but they seem to heal much more efficiently for some reason. Anyway, so how's he going to do? Well, Cam's always relied on more than just his arm as a quarterback. He's a big dude, and while he has a cannon, he can throw that. He can throw that thing 80. He can throw that football 80 yards, no problem. But he could bowl you over. If he can't get that throw, he can run your ass over and, get that first down.
Yeah, I think that's the big concern for Patriots fans is they saw him last year and it didn't really look like Cam. Like
Yeah.
it looked like his arm was weaker
Yeah.
or something. Because they were saying like no training camp. He had COVID and he was obviously affected by COVID. He obviously missed the game.
Yeah.
And then the 2 weeks after that wasn't very good, but he was decent the rest of the season. But what does that mean now that he's signing a bigger contract and coming back?
Sure. Like I said, it's hard to tell. I mean, those could be all the things that affected the way he performed last year. But again, like I said, it could be that he's playing through pain, right? And if you're in a lot of pain, the strength may be there, but it's an awful. It's much more difficult. It's much more difficult to play when you're having pain. So that may be why he looked a little different. Who knows? This year he may not have any pain, and he may do very well in this next season.
Any thoughts on the potential lingering effects of the Lisfranc injury?
So Lisfranc injuries for people. I'll just tell. Lisfranc injury is an injury to the foot. It's a type of fracture that used to be devastating to individuals. I think they actually used to amputate people's feet because these things wouldn't heal very well. Now with surgery they can heal, and I don't think that injury is causing him too much trouble now because he probably limped and given it away at some point, right? So if his foot was hurting, you'd probably notice that at some point during a game or some point when he's walking, somebody would notice that there was a limp. That would be a sign that something's lingering. But we don't see that, so I don't think his foot injury is affecting him at this point. The other thing to consider is the cuff repairs worked. His rotator cuff is healed. He could still be in pain and just be playing through it. Quite a few of these athletes are tough guys, and they play right through their injuries.
All right, Eric Fisher.
Achilles tendon rupture. So, anybody know why it's called the Achilles heel, by the way? So Achilles was in Greek mythology, a champion. Everybody's watched these movies about the Greek mythology. But, apparently he was dipped into the river Styx that was supposed to protect him by his mother, and she held him by his heel. And so that's the only part that the water did not flow over. Another part of the myth says that she covered him with ambrosia, which was nectar of the gods was the food, ambrosia was the drink of the gods. He covered him with ambrosia and then put him in a fire to burn the mortality out of his body. And his father came in, saw that happening, and grabbed moms, pulled her away, and that didn't complete the spell or whatever you want to call it. So that's why that part of his body, the heel, that didn't get the mortality burned out of it, was the weak spot. The term Achilles heel didn't become a term that referred to a weakness until sometime in the 1800s. Don't ask me how I know this silly trivia, but Google it. I think that's what I think I'm right. But anyway, that's the story. Achilles, the one everybody knows is that he was dipped in the river Styx by his mother. He was protected from all sorts of harm. Nothing could harm him. But then Paris, another legend, shot him with an arrow during the Trojan War, hit him in the heel, and that's how he died. And it was supposed to be a poison arrow. The Achilles tendon doesn't have vascularity, so I'm digressing. Anyway, that's the story.
But with him getting released and the injury happening in January,
Yeah.
what would be a timetable for a giant human being to come back?
They're out for the season. They're out for a season. He's not on a team right now, but usually when somebody ruptures an Achilles tendon, they're not going to be playing for that year, for that season, because they have to get the repair done. They have to go through rehab, and you don't want to re-rupture. Come back too soon, you might re-rupture that thing, and you don't want to go back and revise a tendon that was ruptured once repaired, and then have to go do it again. Remember that blood supply is tenuous. The more times you go inside there and try to re-rupture to operate, the less likely your outcomes are going to be as good as they could have been if you just get it right the first time. So I'm not sure what happened. This happened in January. I'm sure he had surgery. Who knows what happened behind the scenes?
So worst case scenario, he's out for the season.
Oh yeah.
What would be a realistic? Let's say not best case scenario. Let's say a good scenario. When could he come back during the season?
I think come back the next season. Yeah, come back next season.
I mean, what month wise?
How many months out?
Yeah, like could you see him coming back in October, November, sooner?
Yeah, 6 months from now. Yeah, absolutely. Yeah, 6 months. I think that's realistic because this happened in January. By October, 10 months, I think realistically somebody could be back playing, especially somebody who is an elite NFL football player. And normal folks like us, this happens to us when we're trying to be weekend warriors and we go out and try to play basketball or do something stupid without warming up, and we tear our Achilles and we end up in a cast or have surgery. In athletes, these happens because the force on the tendon, the Achilles tendon, which is made up of contributions from the gastrocnemius, the soleus, and the plantaris muscles, form this big tendon, the biggest tendon inside the body. And that tendon is what causes your heel to point down, your toes to point down, right? So when you flex, when your calf muscles contract, the gastroc soleus and plantaris contract, they pull the tendon, and that pushes your toes down. So obviously that's what you use when you're going to take off running, right? You want to get up on your toes and push off and run. So the injuries often happen when that's happening. They can happen when there is an eccentric contraction. In other words, the length of the tendon is shortening while the contraction is happening. The length of the tendon is increasing while the contraction is happening. So if the force is great enough, it can tear it. So that's usually how Achilles tendon ruptures happen. Now, they can be treated with surgery, or they can be treated without surgery. Without surgery, you put the person in a cast with the foot pointing down so the tendon edges are next to each other, and leave them in a cast until it heals, and then you start moving them slowly. The operative technique is to sew some really thick suture into the tendon on both sides of the ruptured tendon, and then tie it together, and then another stitch to wrap everything together. Put them in a cast, but you can start moving sooner because the tendon is held together by the suture repair. Now, there's issues with both. The literature used to tell us that when you treated people non-operatively with Achilles tendon ruptures, they had a 10 to 40% risk of re-rupture. So up to 40% of the time, the literature was telling us that people re-ruptured. Now, with surgery, the re-rupture rate is about 2%. But with surgery, there are other issues that come up, and one of them is wound healing. So it's not a very well vascularized area, so you can have skin healing issues above that, and that was the issue with operating on these. But for an elite athlete, they're going to operate, right? Because they want to make sure that there's reduce the chance of re-rupturing. You want to get the strength back, and you want to get that person back to playing as soon as possible, which takes a little longer. Interestingly enough, studies have shown that the strength of the Achilles tendon with repair, surgically or treated non-operatively with immobilization, the tendon strength in the end ends up being the same. It just might take a longer time to get to a point where the person's back to playing form if you treat them non-operatively, which is why most people who are professional athletes end up having surgery. Anyway, so can somebody come back? Sure. Again, I will stress that elite athletes are a little different from the rest of us, so they have a better chance of coming back than any of us. Is there going to be a difference in the strength? I think there probably is.